Have you ever pondered the intricacies of vaginal cervical cytology? While it may sound complex, it's a fundamental part of women's healthcare. Today we dive into this intriguing topic, unraveling its mysteries and importance. Vaginal cervical cytology, also known as a pap smear, is a procedure that tests for cervical cancer in women. The name might sound intimidating, but it's a relatively simple and crucial examination. It involves the collection of cells from the cervix, the doorway between the vagina and uterus. This sampling allows for the detection of any abnormalities that might suggest the presence of precancerous or cancerous cells. This procedure is named after Dr. George Papanicolaou, a pioneer in cytopathology and early cancer detection, who introduced this test in the early 20th century. It's thanks to his work that millions of women can now live with the peace of mind that regular screenings provide. So, how does vaginal cervical cytology work? First, a tool called a speculum is used to gently open the vagina, providing access to the cervix. Then, a brush or a spatula is used to collect cells from the cervix. The collected cells are then spread on a microscope slide for further examination. This process might sound a bit uncomfortable, but it's usually quick and causes minimal discomfort. The primary aim of vaginal cervical cytology is to detect any potential changes in the cervical cells before they develop into cervical cancer. It's an early warning system, if you will. Regular screenings can help identify any abnormalities early on, thereby significantly increasing the chances of successful treatment and recovery. Vaginal cervical cytology is a cornerstone of preventive healthcare for women. It's recommended for women between the ages of 21 and 65 years old, and should be performed every 3 to 5 years. However, the frequency may depend on various factors such as age, overall health, and previous test results. Now, it's important to note that a positive result doesn't necessarily mean that cancer is present. It merely suggests that there may be abnormal cells that need further investigation. Additional tests such as a colposcopy or a biopsy may be needed to confirm the presence of cancer. In conclusion, vaginal cervical cytology, or a pap smear, is a vital tool in women's health. It's a simple procedure that plays a crucial role in the early detection and prevention of cervical cancer. While the thought of undergoing this test might cause anxiety, it's important to remember that it's a key step in ensuring a long, healthy life. So the next time you hear the term vaginal cervical cytology, remember Dr. George Papanicolaou and his revolutionary work. Remember the countless lives this simple test has saved and continues to save. And most importantly, remember the power of preventive healthcare and early detection. May this knowledge empower you and the women in your life to prioritize regular screenings. After all, health is wealth, and prevention is always better than cure. Thank you for joining us on this journey into the world of vaginal cervical cytology. Stay curious, stay informed, and most importantly, stay healthy.